In this video, we'll discuss about hemolytic disease of newborn, erythropoiesis fetalis. It results in RH incompatibility. RH incompatibility between mother and fetus. So, RH incompatibility between mother and fetus. Manifestation of hemolytic disease of newborn, they are erythroplastosis fetalis, erythroplastosis fetalis, then Icterus gravis neonatorum, Icterus gravis neonatorum, then Kernicterus and Hydrops fetalis. So what are the manifestation? Erythroplastosis fetalis, Icterus gravis neonatum, then Kernicterus and Hydrops fetalis. Now, what is the role of RH factor in hemolytic disease? When the mother RH negative, the genotype of mother is small dd. Father is RH positive, so the genotype is of father is either capital DD or capital D or small d, whether two capital or one capital or one small d for father. When the mother is RH negative, small dd, the father is RH positive. Okay, this one is capital DD. The offerings may be RH positive. So baby may be RH positive. When the mother, the genotype small dd, father RH positive. When the genotype capital D and small d, the offerings may be RH positive or RH negative. Serious complication can occur if RBC of the baby containing D antigen, because baby RH positive. This antigen it may passes in the placenta from the fetus to the mother. They enter maternal circulation. So RH positive of the baby containing D antigen. Because the baby RH positive, mother RH negative, this antigen it may passes in the placenta from fetus to the mother, and they enter maternal circulation. When the small amount of that fetus blood leak to that maternal circulation at the time of delivery. So what is the mechanism? As we discussed, the fetus is RH positive, mother is RH negative. So at the time of delivery, fetus obviously containing D antigen, they enter maternal circulation. Before delivery, fetal and maternal blood do not mix. That's why first child is normal. So this one not affected. First child, at the time of delivery, when the fetal blood enter in the maternal blood within first month after delivery, mother develop anti-RH antibody. These antibody are IgG type, and they can be able to cross the placental barriers. Once these antibody are formed in the mother, they remain in mother blood for long period of time. It is presented long period of time. Therefore, second and subsequent pregnancy, if the child again Rh positive, and the child containing D antigen, that anti-D Rh antibody, they are present in the mother blood. They enter in the fetus circulation because they are IgG type. They can cross the placental barrier, and this antibody, they causes agglutination. They causes agglutination of that fetus RBC, which result in hemolytic disease of newborn. So changes that occur in fetus, they are known as hemolytic disease because these are due to hemolysis, destruction of fetus RBC by maternal antibody. Note here, if the mother is Rh negative, the mother is sensitized by Rh positive blood. Mother is transfused with Rh positive blood. Chances of erythropoiesis fetalis in the first child is also there. Another important note is ABO incompatibility, rarely produced hemolytic disease of newborn because anti-A, anti-B antibodies, they are IgM type and cannot cross the placenta. So now discuss that manifestation of hemolytic disease of newborn. First and foremost one, erythroblastosis fetalis. It is due to Rh incompatibility, different between Rh blood of mother and baby. Here there is abnormal hemolysis, hemolysis of RBC by Rh antibodies that produce anemia. There is appearance of large amount of number of appearance of large number of erythroblast in that peripheral blood, which is also known as erythroplastemia, abnormal erythroblast. So it will cause erythroplastemia. Next, what is the causes of erythroblastosis? Here, increasing erythropoiesis from extramedullary tissue, that is also known as extramedullary hemophysis. Extramedullary hemophysis. There is rapid production of RBC from bone marrow, liver and spleen, and these RBC are immature, known as erythroblast, and the disease is known as erythrophysis. Erythrophysis fetalis. So rapid production of RBC from bone marrow, liver and spleen. These RBC are immature erythroblast, and the disease name is called as erythrophysis fetalis. Next manifestation, Icterus gravis, neonatorum. In newborn, jaundice may occur within 24 hours after birth. So here newborn may occur jaundice within 24 hours, and this is because of excessive hemolysis that produce hyperbilirubinemia and jaundice. Along with that, baby is having hepato and splenomegaly, enlargement of liver and spleen. So newborn jaundice occur within 24 hours. After that, excessive hemolysis produce hyperbilirubinemia and jaundice, along with the baby having enlargement of liver and spleen, hepato and splenomegaly. Next, Kernicterus. Kernicterus. Because of hemolysis, there is neurological syndrome occur in the newborn. Neurological syndrome here, excessive bilirubin which formed it may enter in the brain tissue of that newborn baby because blood brain barrier is not well developed in infant. So here this excess amount of bilirubin may enter in the brain tissue of that newborn baby because blood brain barrier is not well developed in infant and it damages brain cell. Bilirubin may affect basal ganglion and it produce disturbance of motor activity. It enhances serum bilirubin level more than 18 mg percentage, 18 microgram percentage. So here because of hemolysis it causes neurological syndrome. Excess bilirubin enter to brain tissue because blood brain barrier not developed. Then this bilirubin may affected basal ganglion, so it disturb that motor activity. First manifestation of that newborn disease, that is Hydrops fetalis, which is severe form of hydrolytic disease of newborn in which there is intrauterine death of that baby occur. Here because of anemia and hypoproteinemia, the baby is edematous. So because of anemia and hypoproteinemia condition, that baby become, it causes edema. Along with that, there is hepatomegaly, splenomegaly and cardiac failure is also observed. In this condition, severe form of hydrolytic disease of newborn, so it causes intrauterine death of the baby. So here because of anemia, hypoproteinemia condition, it causes edema to baby along with hepatomegaly, splenomegaly and cardiac failure also observed. Then how to prevent this hemolytic disease? During second pregnancy, okay. Hemolytic disease of newborn during second pregnancy is prevented by injecting single dose of anti-RH antibody to the mother at 28 to 30 weeks of pregnancy or within 24 to 48 hours after delivery. So here what we want to give, injecting single dose of anti-RH antibodies when 28 to 30 weeks of pregnancy or within 24 to 48 hours after delivery. So what is the mechanism here? The antibody which we are injecting bind to fetal antigen and they inactivate the fetal antigen. Before this fetal antigen, they activate maternal immune system and produce antibody. So the antibody which we are injecting, that one will bind to fetal antigen. So they inactivate that fetal antigen. Okay, next treatment. 50% of that fetus as well as newborn, they have mild hemolysis and therefore they don't require any treatment. They can be given what are the things we want to given? Phototherapy to treat that hyperbilirubinemia. So for treating hyperbilirubinemia condition, we want to give phototherapy. In severe cases, exchange transfusion of that baby. Exchange transfusion to the baby is given if the disease is diagnosed in the intrauterine life. There is intrauterine fetal transfusion can be given it by intraperitoneal route as well as exchange transfusion given after birth of that baby. Here reflexment of RH positive blood of that baby by RH negative blood is advisable. So This is all about hemolytic disease of newborn. In this video, we discussing four different type of hemolytic disease of newborn. RH negative mother, RH positive fetus only causes severe complication. After delivery, the D antigen entered to first delivery no problem. After delivery, the D antigen entered to maternal circulation. It causes four different type of disorders. We discussed all the four things. So it causes hemolytic diseases, anemia, then erythroblastomia, then extramedullary hemophysis, erythropoiesis fetalis, hyperbilirubinemia and jaundice, liver and spleen enlargement. Bilirubin excess amount entered to brain and it affected that basal ganglion, so it disturbed that motor activity. Thanks for watching.